So my job as the ITF or Indigenous Transition Facilitator is to basically support any Indigenous patient who comes in from ER to admitting, and I connect them to SOHAC or even just resources in the hospital. So whether they need to sweat to pray or just help through the system, that's kind of my role.
And how long have you been in this role?
In August, it'll be 2 years.
And how have you seen your role change over those 2 years?
Well, 2 years ago, it was a brand new position. It was newly funded, and it was just kind of make it what you see fit. So it's changed drastically.
Yeah, I
So
can imagine you came in and sort of had to mold it to the knowledge you had, and as issues came up, sort of make it your own.
yeah,
That's exciting.
yeah, it was because you can really help everybody on a personal level. Like it's really tailored to the client, the patient. So
And what's been the response so far?
so far, so good. Everybody's been kind of excited. Like they don't know that we were here. And at the end of it, they're usually very happy and didn't know that there was support like this.
Yeah, because this is unique, as I mentioned, in the province. Can you help people understand what we're doing here in Windsor that isn't being done in other parts of the province?
Yeah, I think a lot has to do with what senior leadership has formed, and it's the partnership with Windsor Regional and SOHAC. It's the first one in Ontario to do that, and bringing myself in, who is with the hospital but not with the hospital. I can connect folks to the resources that SOHAC has, which is our circle of care model, our traditional healing liaison, our social work, our primary care team. So that's been kind of the good thing.
Wida, I want to bring you in because I want you to help us understand what SOHAC does in the bigger picture. So people who maybe are hearing that acronym for the first time, explain what you guys do.
So we are one of the 10 AHACs found throughout Ontario. So we are in the most southern part. So we focus on that healthy, balanced lifestyle of through looking as the person as a whole. So we focus on their mental, their physical, their spiritual well-being. So we kind of follow that medicine wheel throughout. And then we also to empower Indigenous families and individuals to live a balanced state of well-being by sharing and promoting holistic health practices.
And Laura, how has your own personal experience with healthcare affected how you approach your role?
Well, I think I was born and raised here, and I've come up through the hospital with family and friends, and just having the knowledge that sometimes you do need extra support, or it's tricky to navigate, and just being very sincere and caring, and having a no judgment, and kind of meet folks where they're at. That's kind of what I bring.
Yeah. What's been sort of the importance of having a more inclusive environment for people who are Indigenous and coming to the hospital?
I just think knowing that someone's here that is more relaxed, not so, it's not very institutional, it's not so like medical, that can be intimidating sometimes. So just having, who I can act like your friend or cousin or auntie, just that extra support that they may need.
What's the most common types of questions that you need to answer or the types of services that you need to provide?
Honestly, it varies by individual and day to day. Smudging has been a big thing. Lots of folks come in from out of town and who that's the way some folks choose to pray and smudging. So I'd have to help facilitate that and get that going in patient room. Just like any other service would have spiritual care, we offer that and help connect to traditional healers and elders if they need that. And that's kind of refreshing for folks who seek that service.
Yeah.
Another one would be just understanding the system and coming like what's next and transitioning them home and making sure they're connected because that's big. We don't want them to fall off anywhere. We want them to get transitioned home and connected to somebody.
What more needs to be done to get rid of stigmas that are attached to the hospitals and make it more inclusive?
Well, there has been a lot done so far, and it has been positive, but I just think more education, more folks talking about it, more folks understanding where we were, where we're at, and where we still need to go. Just more knowledge about it and understanding.
Where were we for people who are not Indigenous and listening to this conversation? What are some of the issues?
Well, provincial, there were some, really, catastrophic things, deaths and we don't need to go there, but it hasn't looked so great for us, which is why we're here now. And yeah, just people,
Meaning that this is all part of the reconciliation efforts.
yeah. So I think steps have been made and it's been great because our roles are created and we're here to help facilitate that. And just making sure that we don't go backwards and mostly staff need to get not like knowledgeable about some of our ways of traditional healing and indigenous ways of knowing and just being more inclusive and understanding and compassionate.
Wita, what can you add to this conversation? How important is this partnership?
Well, I think it's really important, especially with Laura's role, because she fills that gap and that continuity of care. So a lot of times in the healthcare, you'll see that revolving door for clients, especially Indigenous clients. So, she connects those supports with services we have at SOHAC. So if, a client doesn't have primary care, she's able to make that connection and introduce them to SOHAC, and then to be able to look at the person as a whole and not just their physical